This is what really happens to your body when your vitamin B12 is low. In this video, I'm going to tell you everything about it. What are the risk factors? Which medications can lower your vitamin B12? Where can you get it? Which foods are sources of vitamin B12? I'll talk to you about supplementation. Values. What is a good vitamin B12 level? Could there be any problems? If your vitamin B12 is high, and what really happens in your body, what are the signs and symptoms? I've picked out 9 signs and symptoms that will show up in your body when your vitamin B12 is low. And I'm also going to talk to you about blood tests. There are some tests that can serve as clues and help with treatment, diagnosis of this deficiency. So, all about vitamin B12. I've gathered a bunch of questions that you all ask in the videos, and I'm going to answer all of them in this video. I'll start by explaining what vitamin B12 is for. I want you to know about 2 functions. The first is in our bone marrow. To produce red blood cells, our body needs vitamin B12. So with vitamin B12 deficiency, you can have problems with the production of these cells by the bone marrow. And also other cells, like white blood cells and also platelets can be affected. It's important to mention that. A lot of people only talk about red blood cells, but the others can also be affected. That's one of its functions, helping in the production of blood cells. The other major function is in the central nervous system, because vitamin B12 is essential for the coating of neurons, for the myelin sheath, so for the myelination of neurons. Without that, you'll have impaired communication between neurons, which can cause a series of signs and symptoms that I'll explain to you. How can you get vitamin B12? There are 2 ways. One is through food, and the other is through supplements. In terms of food, which foods are sources? Mainly foods of animal origin. So eggs, fish, seafood, liver, chicken, and red meat. Dairy products are also sources of vitamin B12, but I want you to highlight red meat here. Just from that, you can already imagine. So are people who don't eat animal-based foods, like vegans, in the at-risk group? Yes, they're at risk for vitamin B12 deficiency, but it's not just them. That's usually what people say. Others too, like people who use medications such as metformin or drugs like the prazole, omeprazole, esomeprazole, pantoprazole, and other medications that also interfere with stomach acid. They can increase the risk of vitamin B12 deficiency in people over 65 because as we age, the cells in our stomach often lose the ability to properly produce a certain type of acid. Actually, it's the parietal cells in our stomach that do this. This acid is essential for absorption, so you can actually make use of vitamin B12. This doesn't happen in 100% of cases, okay? Everything I'm talking about here is just a risk factor. For example, metformin. I'm not against metformin. I often prescribe metformin since I treat diabetes. So I prescribe it a lot of times. I'm not against it. But I'm just warning you that you'll have a higher risk of developing this deficiency. Same thing goes for people over 65. It's an additional risk. And it's not that everyone will have it, okay? Let's not get confused here in the video. A lot of people think it's either 100% or 0. Nah, this is just an increased chance. What are the other groups that also need to pay more attention to vitamin B12? People who have some autoimmune disease, like thyroid disease, Hashimoto's thyroiditis, for example. Or Graves' disease, which is autoimmune hyperthyroidism, even fibromyalgia or lupus. People who have any of these diseases will have an increased risk of also developing a condition called pernicious anemia or gastritis. Atrophic, which is also an autoimmune disease, ends up preventing the production of intrinsic factor, which is essential for the absorption of vitamin B12. So anyone with an autoimmune disease needs to get screened. People who have had certain surgeries, like bariatric surgery, are also in the risk group. It's important to check vitamin B12 levels. Excessive alcohol consumption. People with alcoholism who drink a lot of alcoholic beverages can also impair absorption. So there are several risk factors that doctors need to assess and be aware of to know which people are at risk. And now, did you know that about 15% to 20% of the population may have a vitamin B12 deficiency? It's extremely common. What is the value that can indicate this deficiency? A normal vitamin B12 level is between 300 and 900. There's what's called a gray zone, which is from 200 to 300, where deficiency could be questioned, but many people show symptoms in this range. So currently, we're considering 300 to 900. Even at the 300 level, many people can also have symptoms. And to help in this diagnosis, we use two markers, two tests that can indicate the presence of a vitamin B12 deficiency even before the levels drop further. What are these markers? Methylmalonic acid and homocysteine. If the person really has a vitamin B12 deficiency, these tests will be high, which does indicate that for that person, the value is low and they need treatment. It's extremely important to remember that when making a diagnosis, it's always important to evaluate other tests that also play a role in the formation of blood cells, for example, like iron, folic acid, and vitamin B6. Many times, a person has a vitamin B12 deficiency, but also has other deficiencies. And if you only treat one type of deficiency, it can actually make the symptoms worse. So what are the 9 signs and symptoms of low vitamin B12? Number 1 is forgetfulness. Did you see that? Vitamin B12 is essential for our central nervous system, so weak memory. And if it's not identified and treated, it can even be a cause of dementia. Look how important that is. It's a reversible cause of dementia. If it's treated, the person can get better. And if it's not treated, it can progress and even lead to dementia. So vitamin B12 deficiency is extremely common. It's a very serious issue and rarely talked about. So forgetfulness stands out. This symptom I listed as number 1 is often the first to show up and the most overlooked, even by the person themselves. Oh no, it's nothing. I'm just forgetful because my routine changed, because something else happened, because I'm worried. And then the person just goes on like that and ends up delaying the diagnosis. It's also interesting to mention that to develop a vitamin B12 deficiency, often it's after you stop eating animal-based foods. Or when you start taking a medication that can affect it, this deficiency might show up after 3 years. There are studies that say it can take up to 5 years, okay? What do I see in practice? A lot of people start taking some kind of medication or have bariatric surgery. They get tests done a month later, 2 months later, and their levels are normal. But that doesn't reflect your current situation. It just shows the reserves you have. And you need to keep monitoring it regularly, okay? I say this because since I also work with patients who have had bariatric surgery, this happens a lot. So the patient goes through the process and 2 months later, everything seems fine. So they stop following up. Then they come back for a new evaluation with extremely low levels and lots of symptoms. And with those memory changes I mentioned, and the same goes for medications like metformin. Anyone taking it needs to get regular tests to make sure they don't develop this deficiency. And symptom number 2 is hair loss. And for many people, this is actually the most serious symptom. That's when they seek help. You might have memory lapses, you might have other changes, but when it comes to hair, that's when a lot of people look for help. And vitamin B12 is also essential for our hair. And the third sign is behavioral changes with an increased risk of depression. Did you know that? Few people know this because it also affects the central nervous system, and that can increase the frequency. So you also need to check your vitamin B12 levels because often the treatment won't work or it might just mask the symptoms. And you'll have an underlying cause there that really needs to be treated for you to actually get better. And sign number 4 is changes in balance. Vitamin B12 is essential for our proprioception. So, changes in balance. A person might feel dizzy, have trouble walking, for example, or even fall because of it. So, you also need to check your vitamin B12. And number 5 is fatigue, paleness, and shortness of breath. This can happen because of anemia, the decrease in red blood cells, which can lead to anemia with those signs and symptoms I just explained. You saw that vitamin B12 is essential for the production of these cells. There's a very important clue in the blood count. When we identify anemia, a reduction in hemoglobin and red blood cells, we need to look at the size of these cells because vitamin B12 deficiency has the characteristic of causing what we call anemia, megaloblastic. These are large red blood cells, unlike iron deficiency, where the red blood cells are small. And how do we know this? You know those abbreviations you see on the blood count? There are several abbreviations. You need to look for one called MCV, which stands for mean corpuscular volume. The normal MCV value is from 70 to 100. And this deficiency, vitamin B12 deficiency, will increase the MCV. So many people show up with red blood cells with an MCV of 110, 115. That's a big clue, sometimes even more. On the other hand, iron deficiency can lead to values of 60, 65, or even lower. So it's a major clue. With just a simple test, the blood count, you can get a lot of information to guide you and not waste any more time. And sign number 6 is reduced physical fitness. For example, you used to be able to climb a flight of stairs, but now you can't anymore. That's it, you're already tired. You used to be able to climb 4 flights of stairs. Now you go up 1 and you're already tired too. You've had a change in your usual pattern. It's really important that you notice this change in pattern because it can also mean a reduction in vitamin B12. And just like the previous sign, it could be due to a decrease in red blood cells that oxygenate our blood. And sign number 7 is vision problems. Did you know that people with this deficiency have a higher chance of having several vision problems, like decreased visual quality, reduced peripheral vision on the sides, and it gets harder to see? And even a condition called age-related macular degeneration, or AMD. You need to check vitamin B12 levels when there are visual changes. Did you notice that on the cover I put a woman with an eye condition? So you always ask what the reason for the cover is. So why is that? Vitamin B12 deficiency, hardly anyone talks about this, can also cause vision changes. And there are 2 other images explaining the cover, which you always ask for in the comments. I never imagined you all would ask so much. Oh, why is the cover like that? There's another image pointed to the stomach, also referring to reduced absorption, which can happen, and changes in acid secretion. The stomach is essential for vitamin B12, as is the intestine. And the other image is of the central nervous system, pointed to the brain and all the changes I mentioned. So that's the explanation for the cover. Let's move on to the signs. The 8th one. Also, vitamin B12 deficiency can cause changes in the tongue, smooth tongue. Changes in taste, called macroglossia, when the tongue gets large, can also be due to vitamin B12 deficiency. And the 9th sign that your vitamin B12 might be low, this one is extremely common, is numbness, which is called paresthesia in medical terms. So tingling sensations, reduced sensitivity, a lot of people associate this with some kind of spinal problem or with diabetes. High blood sugar levels can also cause this. But vitamin B12 deficiency is one of the main causes. So if you feel sensitivity when you lie down, for example, if the sheet feels like it's burning or you have tingling in your arms or legs, you need to check your vitamin B12 levels. Did you know that your vitamin B12 can also be high? And there are also some signs and symptoms of high vitamin B12. Things like acne, oily skin, abdominal pain, nausea, and vomiting. And when we have these signs and symptoms of high vitamin B12, just like I mentioned with low levels, you also need to check it. And one of the things to check is whether the person is taking any medication or supplement that contains vitamin B12 or something that could interfere with absorption and increase the levels, for example. So that's the main cause. But liver and kidney diseases can also raise vitamin B12 levels. And what about treatment? Once it's identified that your vitamin B12 is low and you need to supplement it, preferably the treatment is done orally or sublingually. In some cases, like bariatric surgery, for example, where we already know the patient can't absorb it, then we prefer other methods, such as intramuscular injections, for instance. The dosage will vary a lot. It depends on the cause, the vitamin B12 level, the patient's condition, their signs and symptoms, and whether or not they've lost the ability to absorb it. It depends on the individual characteristics. There's no way I can give a one-size-fits-all dose here. And honestly, I'm not even allowed to do that. I just want to warn you to be careful with these vitamin B12 supplements. Always use them under medical supervision. Y'all know I don't sell any kind of supplement or medication. On a scale from 0 to 10, what score would you give this video? Do you still have any questions? Who knows? Maybe I'll make a part 2 video. I also want to know which city you're watching from. I'm speaking from Porto Alegre. Let me know which part of the world you belong to. Now, I'm going to leave a suggestion for you to watch. It's a video where I talked about vitamin D. Do you know the signs and symptoms of low vitamin D? Where can you get it? What are the ideal levels of vitamin D? I've already made a video about this. Vitamin D deficiency is extremely common, and you need to know more about this vitamin. If you click here, you'll be taken to the video where I explained about vitamin D. Take care.